Despite advances in addiction research that support the claim that substance use disorders are medically based and recognized, public opinion of individuals struggling with this disease remains almost entirely unchanged. A stigma exists for individuals with substance use disorders, and the stigma is largely the result of current terminology which elicits blame and portrays individuals suffering from addiction as weak and lacking sound moral judgment. This existing stigma lends individuals suffering from this disease to feel as though they are inferior and incapable, making it more difficult for them to accept help and/or complete a successful drug recovery. With so many individuals and families impacted by addiction, it is important that efforts be made to change our language. According to the National Institute on Drug Abuse, addiction is defined as a chronic relapsing brain disease that is characterized by compulsive drug seeking and use despite harmful consequences. It is considered a brain disease because drugs change the brain. They change its structure and how it works. These brain changes can be long-lasting and can lead to the harmful behaviors seen in people who abuse drugs. Addiction is just like many other illnesses such as heart disease. With a clear understanding in the scientific community as to the medical legitimacy of addiction, why is it that addiction remains to be seen as more of a moral affliction rather than a medical condition? The answer is simple. It always has been, and existing language perpetuates the blaming of individuals suffering from substance use disorders for their condition and classifies them as weak, unsavory individuals unwelcome in society. It is not shocking that the public continues to view individuals suffering from addiction as inferior in light of the existing stigma. There remains lots of controversy as to the root of addiction, which has created a moral versus biological debate. Many individuals that feel addiction is more of a moral failing see individuals suffering from the disease as the root of the problem and are able to justify a lack of empathy. Individuals suffering from addiction are seen as more blameworthy and dangerous than individuals suffering from mental illness. The majority of the U.S. public views individuals struggling with addiction as lazy, losers, and having no future. Drug addiction elicits greater stigmatization than other types of mental illnesses, and there is a greater desire by the public to be socially distanced from such individuals. If you regularly engage with current news articles, radio, and television, you are probably very aware of today's current opioid crisis. As is common in the media industry, a focus is placed on the stories that are most sensational and unfortunately often fail to cover stories offering hope for recovery. When discussing individuals suffering from drug addiction, the media rarely makes attempts to showcase these individuals with integrity, but rather uses terms that perpetuate the existing stigma regarding addiction, such as drug abusers and addicts. Unfortunately, major media outlets, including the New York Times, the Associated Press, the Boston Globe, and National Public Radio, say they have not been asked to change addiction terminology, had not discussed doing so, and have no policies addressing the issue. Junkie, addict, abuser, dirty, replacement therapy. These are just a few of the many words that exist in today's terminology used to discuss addiction and addiction treatment. The problem with these words? They continually contribute to the stigma that exists today for individuals suffering from substance use disorders. These stigmatizing words discourage, isolate, misinform, shame, and embarrass. When an individual suffering from a substance use disorder is referred to as a junkie or addict, they are labeled by their illness. According to the American Psychological Association's Guideline for Non-Handicapping Language in APA journals, it is imperative that we put people first and not their disability, or in this case, addiction. Visiting fellow for the U.S. Department of Justice's Office for Victims of Crime, Dr. Johnson comments, "Addiction is a social health problem. Words carry a lot of weight, and when you use words with negative connotations, it is hard to get people to buy in support of much-needed programs." According to Ferdinand de Saussure, our perception and understanding of reality is constructed by the words and other signs which we use in a social context. Signs and media are the only means of access to thought or reality which we have. If current language used to discuss addiction consists only of negative, blaming, and dehumanizing terms, the availability of these constructed words and signs will cloud the thoughts and reality of society as they relate to addiction and those suffering from it. We are incapable as a society of seeing addiction as a legitimate disease without existing language that stops communicating that addiction is a morally unfortunate circumstance that happens to bad people who make bad decisions. We are also incapable of perceiving individuals with substance use disorders as upstanding citizens when all existing language communicates the contrary. Besides dehumanizing an entire subculture of individuals suffering from a disease that remains almost unrecognized by the general public as legitimate and worthy of attention, the current stigma impacting those affected by addiction has severe consequences. Only 1/3 of individuals with substance use disorders seek treatment. Of those who choose treatment, the care that is received may not be the same quality as received by an individual who is not suffering from addiction. Individuals seeking treatment may experience social isolation from their friends and family as a result of the stigma associated with addiction. Treatment is often less successful due to the self-stigma that develops as a result of existing societal stigmas. I decided to interview Brittany, a 24-year-old female currently using heroin intravenously, for comment. When asked if the existing stigma towards addiction impacts healthcare, Brittany replied, "Absolutely. It is a big reason not to go to rehab. When I first realized I was addicted, I tried to avoid rehab because I don't want people to associate me with that. It took me much longer to get help because I wanted to avoid that stigma. Some people will just never let it go." When asked if her addiction has impacted the medical care she has received, Brittany responded, "I had a tooth that had completely eroded, but because in my records I was a drug addict, they would not give me any pain medicine. They look at you as only being in there to cop some pills. I've definitely been treated differently by doctors since my addiction began." When asked if she felt the current addiction stigma and language impact success and recovery, Brittany responded, "Yes, it puts you down. Maybe I am just a junkie and I'll never get better. Sometimes it makes you want to show them, but sometimes it makes you depressed and you just use more." To begin reversing the existing stigma, we must change the words of addiction. This will allow patients to more easily regain their self-esteem, allow lawmakers to appropriate funding, allow doctors to treat without disapproval of their peers, allow insurers to cover treatment, and help the public understand that this is a medical condition as real as any other.